welcome to Psychiatry Education Forum Academy's next video chapter. And the topic for today is understanding cardiac risk with Lamotrigine. So, such a commonly used medication, right? Used for psychiatric conditions like bipolar, major depressive disorder, augmentation strategy, impulsivity management, and many other conditions, neurological conditions like seizure disorders. So I think it's really vital to understand these cardiac risks associated with Lamotrigine. And I am Dr. Harvinder Singh, creator of Psychiatry Education Forum Academy. And the reason we decided to do this is in 2021, there was actually FDA did this drug safety communication on Lamotrigine, and the communication said that Lamotrigine could cause serious arrhythmias or death in patients with certain underlying cardiac disorders or arrhythmias. This was released in 2021. So to make it a little bit more clinically relevant, I have also reviewed this update or article published in the Epilepsy journal. So this was actually recommendations or advisory given by this task force called International League Against Epilepsy / American Epilepsy Society Task Force. So let's understand this in various sections right now, or I should say various questions. So the first question is, what is the mechanism, right, behind this cardiac risk with Lamotrigine? Now, we know that Lamotrigine at therapeutic concentration is known to cause class 1B antiarrhythmic activity. Thereby, it inhibits the cardiac sodium channels. But in patients who have structural heart disease, myocardial ischemia, or risk factors that I will talk about in a few minutes, so in those high risk population, when Lamotrigine does that, it can prolong the QRS by slowing the ventricular conduction rate, and thereby it induces proarrhythmias. But the key point is, in healthy individuals, it will not do that at the therapeutic concentration. So the risk is only for patients with risk factors, which we will talk. And also for patients who have elevated heart rate, the risk of proarrhythmias by prolonging QRS also increases with Lamotrigine. So that is the mechanism how Lamotrigine can do that in at-risk patient population. The second question is, which patient population is at risk here, right? So that we can keep an eye on that. So first thing, like I just mentioned, healthy individuals do not have this risk with Lamotrigine. So there are two risk groups that this task force recommended. The risk group number one is patients who have cardiac conduction disorders like second or third degree heart block, patients with cardiac diseases or anomalies like myocardial ischemia, patients with heart failure, patients with valvular heart diseases, or with a congenital heart disease, or patients with ventricular arrhythmias, or like these cardiac channelopathies like Brugada syndrome. But also patients with drug interactions are also of importance in this, mainly if you're using other sodium channel blockers, like with the same activities, prolonging QRS, inducing proarrhythmias and risk of death. So that's the additive side effect with drug interaction. But also in patients who have multiple risk factors for coronary artery disease, which I will mention in a few minutes. So this is the most common risk group that we need to keep an eye on. I think this is the main group that we need to keep an eye on with our patients. If your patient have these, be cautious with lamotrigine. Now the risk group number 2 is very interesting because they actually mentioned that there is this metabolite for lamotrigine. It's called 2N-methyl metabolite. And the studies were done in dogs. And they found that this metabolite has a dose-dependent impact on prolonging the PR interval, widening the QRS complex, and at higher doses causing complete AV conduction block. But the good news is this is available in very trace amount in human. Like you can see here, less than 0.6% of the lamotrigine dose is found in human urine. It's because of the metabolism that goes in. The glucuronidation of lamotrigine prevents this. So in patients where this metabolite can go up where the glucuronidation of lamotrigine is getting impacted, and there are 2 groups which can do that. Number 1 is patients with liver disease, right? Because that's where that metabolism happens. And second is drug interactions, right? If a patient is on medication that inhibits glucuronidation, that can raise this metabolite. So you need to be really mindful of drug interactions with lamotrigine. So we have a totally different chapters on that. Drug interaction one, please go and read that. But these are the major 2 groups. I will put more emphasis on group number 1, but not ignoring the group number 2 here. Now, so the question comes, in which patients will you consider doing EKG before even initiating lamotrigine? And these are the one. So for patients who are more than 60 years old, irrespective of what they have, you need to do it. And the guideline says because after this age, the likelihood of having undiagnosed conduction abnormalities increases. So any patients who is more than 60, you're planning to start lamotrigine, consider getting EKG done. That's number 1. Number 2 is patients who are less than 60 and they have major cardiovascular risk factors like what we were mentioning in risk group number 1. So these risk factors are patients with diabetes, patients with hypertension, patients with familial hypercholesterolemia, and patients who are smokers. And the third group is patients who are less than 60 and have known cardiac disease, right? These are the one where you will consider getting an EKG done before initiating lamotrigine. Now, let's say patient is already on lamotrigine. When is EKG needed in that? And this is really interesting. So in patients who are already on lamotrigine and they report this symptom, which is sudden onset of syncopal or pre-syncopal episode with loss of muscular tone in the absence of clear vasovagal or orthostatic cause. If your patient reports that, you need to get the EKG done there. Really important to know. Now, let's say you do EKG. Which EKG findings will warrant that you should not start lamotrigine again? So these are the findings briefly. Patients who are found to have 2nd and 3rd degree heart block, right? We already talked about that. That's a risk group number 1. Patient with Brugada syndrome, that's in risk group number 1. Patient with arrhythmogenic ventricular cardiomyopathy, patient with left bundle branch block, or patient with right bundle branch block with left anterior or posterior fascicular blocks. In these cases, you need to refer them to cardiology for further evaluation and clearance. Now, the next question is, let's say patient is on lamotrigine. When will you consider repeating EKG during lamotrigine treatment? And for that, you need to keep an eye on that risk group. If you're using this in patients who are in those risk groups that we talked about, in these patients, when a patient is at the target dose of lamotrigine, mainly either in terms of dose or serum level near or above the upper limit of the therapeutic range. So I also do levels of lamotrigine in some of my patients when needed. So be mindful of that when you're at the topmost, like maximum range, or you're crossing that, and a patient is a high-risk group, you need to repeat EKG in these patients. The second thing is drug interaction, like we talked before. Patient is on other sodium channel blockers, or patients is also on other medication known to impair the atrioventricular or intraventricular cardiac conductions. So friends, last thing is, how will you educate your patients? Actually, this is a summary of this whole talk today. So these are the points you need to discuss with your patient after prescribing, before prescribing lamotrigine. Number one, lamotrigine can result in irregular or slowing of your heart rhythm. So keep an eye on that. The risk is increased in patients with underlying cardiac disease, or patients with heart conduction problems, or patients who are on other medications that can affect heart conduction. Third point is, they should be made aware of these cardiac symptoms, and they should contact the healthcare professional right away if those happens. And the last thing is, if a patient develops syncopal episode, they should lie down, raise their legs, and contact the healthcare professionals. So friends, I hope this was clinically relevant. I tried to make it short so that you all can watch this in your free time, and please share your thoughts. This is my email if you found this clinically relevant. And for our Academy members, we have a full section on managing adverse event with mood stabilizer. This is one of the topics on that. So we have a full section on the lithium. As you can see here, these are individual chapters on managing lithium adverse event. We have section on valproate, lamotrigine. This is the one section that I just talked about, and topiramate. Psychiatry Education Forum Academy is academy membership for healthcare professionals only. You can go to psychiatryeducationforum.com and read more about this membership. But if you have any question, you can send me your email at my email that I mentioned here, hsingh@psychiatryeducationforum.com. But friends, thanks again for listening to me. I will see you all in our next video discussion. Till then, you all take care, and bye for now. Thank you.